Good evening. I'm Salma from Shaukat Memorial Cancer Hospital. The study was done in Shaukat Memorial Cancer Hospital to assess the knowledge, attitude, and practice of healthcare professionals for the waste management. Waste management is considered as the second most dangerous waste in the world. I'm unable to change the slide. Importance of the topic is that the quality of proper medical waste is a key strategy to enhance the standards of the hospital and also avoid injuries and infection or diseases. The purpose of the study was to assess the knowledge, attitude and practice of healthcare workers on medical waste management. The existing proper medical waste management also may be influenced by the attitude and the enthusiasm of the techniques of the healthcare professional working in the areas. By exploring the results of this research, the healthcare workers of the following department can establish new principles to fulfill their task. The study design is the cross-sectional study, and the targeted populations were 150 healthcare professionals working in 3 departments in 3 shifts. The area focus was operation theatre, emergency assessment room, and chemo bay. The sample size is 109 targeted healthcare professionals from the Shaukat Memorial Cancer Hospital. The sample size was calculated with 95% of the confidential interval. So the e-value is 0.05 of the total population. A questionnaire was developed based on the waste disposal guidelines and to assess the knowledge of the healthcare professional working in this area. This questionnaire was initially done underwent a pilot study to see the effectiveness of this questionnaire. 2 research methods were used to collect the data: a pre-tested questionnaire and a semi-structured interview and observation conducted by me by using a checklist. The content validity was obtained by sharing my findings of the pilot study with my supervisor, with the professor of College of Nursing, and the reliability of this questionnaire was obtained through a pre-testing of 60 healthcare workers who are working in Shaukat Memorial Cancer Hospital, different areas. The inclusion criteria was that all registered nurses, housekeeping staff, doctors who are working in Shaukat Memorial Cancer Hospital and they are willing to participate in the study. The age range was 20 to 50 years and the experience shouldn't be less than 2 years. The exclusion criteria was healthcare workers who are not involved in the waste management or are not willing to participate in the study, aged less than 20 years or more than 50 years. Ethical consideration was also taken care in the study and formal approval was taken from principal of College of Nursing. The consent was taken from the participants involved in the study to get a formal permission and that they want to be part of that study, and they were informed that their information will be kept confidential and their names or the provided information will not be shared or highlighted with the names. The research tool in this study, the research tool was a questionnaire used to collect the information related to the conducted research. The questionnaire was consisting on the different kind of questions which will be again reflecting in the result part. Here are the results of my study. You will see that the maximum number of participants were nurses who have participated in this study, and the second most number were the housekeeping staff. They are directly dealing with the waste. If we see at the age limits is the maximum age of participant was 40 years. The departments which were involved, I have said that emergency, area, Chemo Bay and OR were the target areas, but as I was located in the Chemo Bay area, so it was most accessible to me and the maximum participants were from this area. So looking into the result, the next slide is about the results of the questions which were given. The first question was saying that the participant considered the sharp waste includes syringes, blades, disposable waste. So we can see that maximum number of staff, that is about more than 80%, agree that these are counted as a sharp. The second question was about segregating of hospital waste. So the hospital waste should be segregated or not, or they are able to segregate the waste and follow the hospital guidelines. So about maximum staff has said yes, they agree that hospital waste should be segregated. The next question was that there is a need of different color waste bins to distinguish the waste. So again, the maximum number of participants agree with it. Healthcare, the question stating that the healthcare waste have sufficient, that healthcare workers have sufficient knowledge about the waste management. The maximum staff have again said yes, they are being provided with the sufficient knowledge to deal with hospital waste. And they were also aware that what is the process for disposing of. Question stating that you as a healthcare setting have the appropriate waste management plan. The plan also exists there and the staff was aware of that. Regarding the biomedical waste management, that this questionnaire was that biomedical waste management is not an issue at all. The maximum staff again said yes, because they all have underwent the competency that was stating how to dispose of the the waste and what are the biomedical waste managements. The safe management of the biomedical waste is an extra burden on the management. So there was a contradiction on that part. The maximum staff agree and disagree at the same time, so almost the percentage is equal. So concluding my study, the hospital employees said that they were comfortable about the current color coding system at the hospital. It was noticed that almost 20% of employees were using used to post waste in working bins quite often. According to the opinion of employees at Shaukat Khana Memorial Cancer Hospital, the important reason for improper segregation of the waste are inappropriate location of the waste bin being full and lack of knowledge regarding the constitution of medical waste. 25% of the employees took part in the survey choose to inappropriate location of the waste bin being full as the primary reasons for the higher production of the waste management. In the study, the results indicate that the healthcare providers have some poor knowledge regarding medical waste management. The study shows that the hospital can be highly benefited from both environmentally and economically by improving the medical waste management. In the end, my sincere gratitude to Mr. Rahmatullah, who was the mentor of my study, and all the workers or all the participants who have taken part in this study, and obviously last but not least, the management who has allowed me to work in this area. These all findings are being shared with the concerned area managers for the improvement of the clinical practices. Thank you very much. And in the last, I'm highly obliged and thankful to the organizing committee of this e-conference and all the participants. Thank you.